Good morning, good afternoon, and good evening. Welcome to this one-of-a-kind event convened by ASPA's section on democracy and social justice that is titled DSJ in Conversation with Dr. David Satcher. This event is the first in a DSJ-sponsored conversation series with leaders in social justice, social, racial, and health equity, and democracy that spans the disciplines. This event is being recorded and will be posted to our social media channels later today, later next week. My name is Curtis Vincent, and I serve as DSJ's Digital Engagement Coordinator. I'm happy to be joined today with DSJ's Chair, Sean McCandless, and a shout out to DSJ member Cynthia Golombeski for her stellar help in making this conversation a reality. In terms of logistics, I will be remaining off camera for the duration of the event as it helps make the video editing go more smoothly. Also, for all of our attendees who are not our two fabulous panelists, please turn off your videos as this frees up bandwidth for the discussion. If you have a question or comment to share, please use the Google form to do so. The bit.ly link to the Google form will be shared in the chat shortly. Now, before starting the conversation with Dr. Satcher that we're all here for today, I am so pleased to introduce you to our amazing moderator, Dr. Vanessa Lopez-Littleton, who is also our incoming chair-elect for DSJ. Dr. Lopez-Littleton is an associate professor of public administration and nonprofit management and chair of the Department of Health, Human Services, and Public Policy at California State University-Monterey Bay. Dr. Lopez-Littleton actively participates in designing innovative graduate and undergraduate programs, works with diverse teams to develop inclusive classroom and academic practices, and serves as a consultant on nonprofit leadership and management. Dr. Lopez-Littleton's research interests include health inequities, the social determinants of health, and racial equity. So, without further ado, Dr. Lopez-Littleton, the floor is yours.
Wow, that was incredible. Thank you for that. I am truly honored to be here today and to introduce Dr. David Satcher. He is the founding director and senior advisor of the Satcher Leadership Institute and a professor at Morehouse School of Medicine. He is a former director of the Centers for Disease Control and Prevention and the 16th Surgeon General of the United States. He's held many other senior leadership positions in academia and in health. He's a lifelong leader for civil rights and health equity. And he is the author of a new book, My Quest for Health Equity, Notes on Learning While Leading. We are so excited for this opportunity to engage you in conversation. There's so much happening in our world and society that this conversation is critical on so many different levels. So I'm truly honored today to begin this, this conversation with you. And so my first question is just kind of a broad warm-up question. It's, as we look ahead to 2021, what is the biggest challenge facing public health and the public sector?
Well, first, let me say how pleased I am to be with you, Dr. Lopez-Littleton. It's a delight. And I look forward to our discussion. You're going to have to ask the question again, because I was thinking about my comment to you.
Absolutely, no problem. So I think this is just a big, broad question. It's like just looking ahead. What's the biggest challenge that public health is facing? And, you know, I know that we have COVID, we have the COVID-19, we have the vaccine coming. We've got a major leadership change at the presidential level. So what do you foresee as like the biggest challenge that's going to face or challenge the public sector, in particular public health?
Well, it's very tempting now to say that it's leadership. When you look at what we've been through over the last few months and problems with the CDC, which were painful for me and many others, but also the working relationship between the White House and scientists, especially the CDC again, and to a lesser extent NIH, but now FDA. So I think it is, public health is the collective efforts of a society to create the conditions in which people can be healthy. And we have seen more difficulty with the collective action during this pandemic, I think, than anything else in recent years, because many of us lived through the eradication of smallpox and now the near eradication of polio. We've been around for the AIDS epidemic now since the early 1980s. So it's a little frightening when you think of how this pandemic has sort of revealed all of our weaknesses, and especially the relationship between politics and science.
Yeah, thank you for bringing that up. I made a quick note about that. I think a lot of scientists are hard pressed now as we move into this era where we're being challenged. Science is being challenged, where I think years ago, decades ago, it wasn't challenged in this way. Is this new, this challenge and this threat to science, or something that existed more back now because of the 24-hour news cycle and social media?
Well, my impression is that while it's not totally new, it's exaggerated because of the personalities involved to a certain extent. I think President Trump, in terms of how he views his role, everybody is working under him, and you may be representing science, but if he says he wants something said this way, he expects that to happen. That was not my experience with President Clinton, for example, when I was director of the CDC. President Clinton had a lot of respect for science, and he listened. He didn't always agree with you on everything, but he certainly listened to scientists and respected the science. And I think the same thing was true of other presidents that I worked with. I worked with President George W. Bush. And of course, we worked together on the AIDS in Africa. And many people don't know it was President George W. Bush who first made the decision to put up the funds to treat the AIDS epidemic in Africa. So what I appreciated when I was in office was not that I was always agreed with, I'm not saying that, but that there was an appreciation for science. There was an appreciation for not just your perspective, but your expertise. I soon after I became director of the CDC is when I received a report from a very large commission, I think about 100 people on it. But as a result, I called that same evening the White House and told President Clinton about this recommendation that there be a major national apology for the Tuskegee study. And, and after he heard the details, he immediately said, I agree. He said, we need to apologize. And on May 16, 1997, I believe it was, in the East Room of the White House, he gave just a moving apology for what the country had done to these 400 plus men in Tuskegee and how inappropriate that was when people trust government and government deceives them.
Yeah, so I was thinking about one of the quotes from your book where you talked about, when you use the overarching goal of eliminating health disparities instead of just closing the gap, and the leadership at the senior levels, like the president, I think it was Bush, who allowed that to go forward. They could have pushed back to say no, but there was a respect and appreciation in allowing public health to work. And so that's not kind of what we're seeing today. I know that in public administration, we talk a lot about the inextricable link between politics and administration. And that same thing is true with public health. And so, when you first started speaking, I heard you talk about, some of the challenges that public health faced. Do you want to comment on that? Like, what the leaders were or were not able to do?
Well, this has been a very difficult season in many ways for public health. And it has had a lot to do with that relationship between science and politics. I don't believe that President Trump really appreciates what that relationship should be so that people can continue to trust the science. And I don't think people can trust the science if it's hampered by politics. If, you know, a lot of people are questioning now, you know, can I really trust this vaccine? And part of the reason they're saying that is that they think, you know, they think that the scientific process is being hampered by the political process. So there are some real dangers, I think, to not allowing science to operate independently. Give you the example, of course, is Dr. Fauci, somebody that I worked with for several years. And Dr. Fauci is highly respected by the American people. He has a lot of courage. He's had to stand up, if you will, to the president on many occasions. But I do appreciate the fact that he has been willing and able to adhere to the best available science. And I think that's what we're supposed to do. Mm-hmm. So if a vaccine is created, we want to know if it's been through the 3 phases of development of a vaccine, phase 1, 2, and 3, coming to a point where the safety and efficacy of the vaccine is one that people can trust. And but there are people, as you know, now who are really questioning the extent to which they can trust the way in which the vaccine was developed. But I personally think that this vaccine is quite safe, and I think it went through a process that was well funded. That process was done because of the need to get a vaccine soon. And President Trump he was supportive of funding an effort that would assure that we got a safe vaccine soon. And we now have it, but there are a lot of people who just don't trust the system anymore.
Yeah, you make me think. I was listening to Dr. Reed Tuckson speak, and he phrased it the disease of distrust. And right. I think we're seeing more and more of that. Yeah. But so I do have another question. I think many of us are especially in public health, are very pleased with the progress we've made in getting 3 vaccines to the point where we're almost ready for mass distribution. Yet there will be challenges in getting certain segments of the public to receive the vaccine. I was listening to Dr. Kamara Jones this past weekend, and she suggested that public health officials not attempt to convince people to take the vaccine, but to instead hear them out by answering their questions and hearing their concerns. And I also know there are many groups like the NAACP, the Black Coalition Against COVID, the National Urban League, the National National Association of Black Nurses, even the Divine Nine, the 9 historically Black Greek organizations, and so many other groups are working to make sure that people are well informed around COVID-19 and its impact on the Black community and also on the vaccine. But what advice or guidance can you provide those who work in the public sector or any other organizations on how best to inform or engage the public around the COVID-19 vaccine?
Well, it's a very important question. And I spent, I guess, about an hour just the other day speaking to a group of religious leaders who had a lot of questions about the vaccine and they knew about my work at the CDC. I don't know if some of you remember, I guess, when I went to the CDC, one of the real challenges was the whole issue of immunization of children. And especially during that time, the fact that so many Black children were not being immunized by the age of 2, as was the goal. And so I was able to develop a partnership with the Council of Black Churches, and they were very helpful in participating in the immunization of children and getting their congregations engaged in that. They were trusted, they were leaders, and we had to acknowledge that. and to ask them for their help. And it paid off. We ended up with something like an 86% immunization rate. And I remember especially places like Detroit. I believe Detroit had a 29% rate of immunization when we started, and it ended up getting the award for the greatest increase, which was, almost fourfold increase in immunizations. So I respect community leadership because people have to earn that. Some of them earn it as ministers in churches. Some of them earn it in other ways, but community trust and leadership, community leadership trust is something that's very important. And I must say, Dr. Lopez-Littleton, you deserve an award if you talked to both Reed Tuckson and Kamara Jones in the same week and came, no, seriously, they're both great people. They're both friends of mine. As you probably know, Dr. Kamara Jones works here.
Yes.
And Reed Tuckson and I have been friends for a long time.
Absolutely. I was a presidential management fellow at the CDC, and that's when I first met Dr. Jones.
Yes.
I reached out to her, and she was engagement, get lunch together. She became a cafe to speak to a couple of small groups that I had set up for her.
Very good.
So those relationships run very deep. Thank you.
Great.
And I'll accept the award.
Yeah.
So I am very curious about, especially when it comes to immunization and doing these types of, programs for Black and Latino communities and the historic problems that we've had. And just, I just know that there's going to be a challenge. I know this is going to be a challenge for a lot of my Black colleagues. I was on a family call with my sisters and brothers and nephews and nieces this past week, and I was asking, are people going to take it? And my brother was quick to say no. And it was interesting to me because he's the most health conscious, just kind of aware person that I almost that I know, and I was shocked that he would quickly say no. And so I will do my best to try to, answer and be responsive to his questions. But how do we get more people to have more faith and trust in the healthcare system, and in particular with this COVID-19 vaccine?
Well, again, I think we have to start by seeking out the people who are already trusted in the community. I know, as I pointed out, I think community leaders are often trusted because of what they've already done, either in building a church and having a lot of members and interacting with them on a regular basis, or in other ways. I just think it's really critical that people see this as an effort that's not limited to a group of doctors who met in a room or whatever and came up with the vaccine, but something that several people participated. I do know that the National Medical Association, which is the predominantly Black association that's been in existence since 1895, when Black physicians couldn't join the American Medical Association. They have been very active in this, and I know that they have encouraged community health center leaders to get involved in encouraging people to participate in the trials, the clinical trials that are now virtually over, but also to encourage people to take the vaccine because it's going to save a lot of lives. I had an experience recently that made an impression on me. I grew up in a small town outside of Anniston, Alabama, and I went to high school at Hopkins City. And I don't know how many of you have even heard that name, but Hopkins City was believed to be maybe the first Black-run city in the country. And that's where I went to school. I caught a bus every day and went to high school at Hopkins City. Well, I'm still in communication with the people there. The mayor had called me a few weeks ago and expressed the fact that she was concerned that a lot of people had doubts about this vaccine, and she wasn't sure herself that she was going to take it. Then, of course, later on, I heard that she had decided to take it. Unfortunately, after a friend of hers died with the COVID-19. And then as we're seeing more and more people, this is a very dangerous virus, by the way. It's very dangerous. And so it is deadly. And I think it's sort of unfortunate that President Trump had his episode with the virus, and it was short-lived, and I'm sure they gave him everything they could find to make sure it was short-lived. And now Rudy Giuliani, the former mayor of New York, who was the president's lawyer, he is sick with the COVID-19. So unfortunately, I think what's going to happen is that people are going to see more and more people getting ill and dying, unfortunately. And more and more people are going to say, well, I'm not going to wait for this. I'm going to take it. Well, that's what we're seeing now. More and more people, like the mayor of Hopkins City, saying, well, I lost a friend to this virus and I'm not going to wait. I'm going to take it. I would encourage people that this is one of the safest vaccines that we've had, and that vaccines are probably the safest health care intervention known to man. To be honest with you, it's because of vaccines that we were able to eradicate smallpox disease. Because of vaccines that Africa recently announced the elimination of polio in Africa, the whole continent. Polio has now been eliminated. And I had a lot of experience with that when I was director of the CDC. I was involved in eliminating polio in India. I hope most of you know that when you say eradication, it has a deeper meaning than elimination. Eradication means that there is no more of the disease anywhere in the world. And as long as there's one case of a disease in the world, you can't say you've eradicated it. You can say, well, we've eliminated it in the United States, in Africa, what have you. I think very soon, and I'm optimistic, we're going to have the announcement of the eradication of polio. Because now I think it's only Afghanistan and Pakistan that we have cases of polio. You have any idea how many people were crippled with polio over the years? And now we're saying we're that close to eradicating it, and we are. So vaccines have had quite an impact on the lives of a lot of people. And but I think it's appropriate to ask questions. I do not criticize people for raising questions and even having doubts. But sooner or later, people are going to have to make a decision to protect themselves somehow against this virus. And it's a very dangerous virus, and it's already killed too many people. More than all of the great wars of our time, by the way. This virus has been very deadly.
Yeah, thank you for that. So you did, in your response, you did go back and bring us a little bit of your youth and your childhood. And so I do want to go back and think a little bit about the book, because one of the things I noticed is you talked a lot about your experiences during the civil rights era, about the influences folks had on your life. So if you want to share some of that, that would be great. And in particular, I'm thinking about parallels that might exist between the civil rights era of the 60s and our current Black Lives Matter movement. Like if you see any parallels there.
Yeah, I grew up in Alabama, on a farm outside of Anniston, Alabama. And the experience was one of racism from almost day one. I almost died of whooping cough because in part because of the hospital in Anniston that did not admit Blacks. So the one Black physician in Anniston came out to the farm where we lived, and he spent the whole day there. And this was his off day, Dr. Jackson. And but as he was getting ready to leave, he told my parents that he didn't expect me to live. But he also took the time to show them what to do to give me the best chance to survive. And from all indications, my parents, especially my mother, did a great job. So, you know, when I was growing up in the early days, I heard a lot about Dr. Jackson. So I wanted to meet Dr. Jackson. So my parents promised me that when I turned 5 years of age, they were going to take me to town to meet Dr. Jackson. I was excited. I mean, I really was excited. It was a mixture of, on the one hand, wanting to thank him, and on the other hand, wanting to say, well, look, you didn't think I was going to survive, but look, here I am. You know how that is. But anyway, I never met him. Dr. Jackson died when I was 4 years of age. And so I started saying, I'm going to be a doctor like Dr. Jackson. And that became sort of a real driving force in my life. That's why I took school seriously. And I believe that whatever I had to do to become a doctor, I needed to get started early. And that was a driving force. That was driving force number one. I was introduced early to racism, not only from the standpoint of healthcare, but I remember going to town with my brothers and I had excited. And as soon as they turned their back, of course, I slipped into the drugstore and asked for an ice cream cone. And the lady behind the counter says, you know, we don't serve your kind, starting with an N. We don't serve blacks in here, but that's not the word she used. So that was pretty early for me to be told that I couldn't buy an ice cream cone. And I don't know to what extent that was true of everybody who was black, but I just remember that. That was sort of my introduction. You would argue that the introduction, which I almost died of whooping cough, was much more important than not being able to buy an ice cream cone. But not when you're 5 years of age. It was the ice cream cone that stands out. But I mean, when I think about the impact that racism and discrimination have had on people of color, including children, I think back to that. But to move a little faster, your question was about the student movement. I ended up going to college at Morehouse in Atlanta. And it was really while I was there, of course, that I met people like Benjamin Elijah Mays, who said, the great tragedy of life is not in failing to reach all your goals, it's in having no goals for which you're reaching. That's what he said to us when we were students, and he spoke to us every Tuesday morning. I heard Martin Luther King Jr. speak, both at Morehouse and in the church, Ebenezer, which he co-pastored with his father, Daddy King. And Dr. King said a lot of things that were memorable, as you know, and most people remember some of the things that he said. But I remember his saying at Morehouse that until a person finds something for which he or she is willing to die, then he or she is not fit to live. That had quite an impact on me because, you know, I wanted to go to medical school. I wanted to be a doctor. But then I realized that, you know, maybe there's something else that I ought to be doing too, even though it may be quite a risk to my overall goal. So I became active in the student movement. I believe it was October 1960. I was just on the phone with a person that many of you probably know, and that's Dr. Otis Moss, who pastored a church in Cleveland for many years. But Otis had just graduated from Morehouse when the students called a meeting that we were going to start a movement. And Otis was now a student at the Divinity School. So in addition to Dr. Otis Moss, you have people like Marion Wright, who is now, I guess, better known as Marion Wright Edelman, Marion Edelman, who headed the Children's Defense Fund for many years, outstanding leader. But I met her as a leader when I was a student. And there were other students from Spelman and Morehouse, and I followed them into the student movement, refusing to get up from seats when the police told us that they were going to arrest us if we didn't, going to jail at least 5 times and to prison once, because we had this plan that we were going to fill the jails, and we succeeded. And so those of us who was leaders, because by this time I was in my junior year, those of us who were leaders were sent to prison. No more spaces in the jail, so they said, we're going to send you to prison. And they did. And some of you know the story, but it was during that time that Mrs. King became very concerned about Dr. King's safety. And because they had taken him out of the jail and took him to Athens, Georgia. And Athens had a very bad reputation for the treatment of Blacks. But anyway, as a result, President Kennedy called the mayor of Atlanta and asked him to let Dr. King out of jail, and he did. And the rest of us were released at the same time. I can tell you a lot of stories about that experience, but I won't, unless you have questions about it. But I learned a lot from being in prison, even though obviously I was not there as long as a lot of other people who go to prison. I took my books with me to jail and to prison because I was determined to go to medical school. And so, but I think it was the experience at Morehouse. It was the experience with the student movement that really set me on a path that whatever else I did, medicine or what have you, I had a responsibility to be involved in helping to create a better society, helping to solve problems related to race, ethnicity, and prejudice and discrimination. That followed me all the way through my career. If you read my book, of course, you will read stories about medical school and how I decided to walk out on a medical school service because of the way 4 Black women were being treated when they were, teaching us the pelvic exam. It was very disrespectful. And so I walked out, and the head of that service threatened that he would have me put out of medical school and that he would see that I didn't get into any other medical school. He was really upset. And that's a longer story than I'm sure you want me to tell, but the bottom line is the next morning, the other students, there were only 9 students on this particular rotation, but the rest of them had caucus. They were all white, but they all agreed that that it was inhumane the way the service was treating those Black women. And so they walked out too. And that was a very critical experience in my life. See, if you read the book, you will get 2 sides to this story. One side is the one, of course, where I walked out on the service and was almost put out of medical school. The other side is maybe it was a leadership issue. Maybe I should have caucused with those other students who are white before I walked out on this service. I don't know what they would have done, but I know the next morning, because I had walked out, they decided to walk out too. And the nurses became very supportive because they were concerned about the way the women were being treated. It was a lesson in leadership, but it was two sides to the story. One is, could I have done a better job of leading? You know, I walked out and put myself at risk, but could I have done a better job of leading this effort? And if you read the book, I raise questions that I don't necessarily answer all of them, but I think leadership is very complex, but leadership is important.
So there's a lot there. I feel like I could go on talking to you for days, but I'll try to keep it moving. But I'll reflect on that, because when I read it in the book, I was thinking, and I appreciate your reflection in saying, you know, that you could have done something differently. But oftentimes when we are faced with these issues related to race, we have to allow other folks to arrive on their own accord because, us trying to influence, tell, or show doesn't really help them get what they need to get. And just by you standing up for your principles or what you thought, was happening in this instance, that was leadership. You didn't have to be a part of the caucus to say, hey, look, this is what's happening. They were able to come to that on their own. So I appreciate the reflection, and I do understand the two separate points. So I appreciate both of them. One where you would have been, more actively involved in trying to get them to understand where, why you thought the women were being disrespected. On the other one, it was like you felt compelled to act on your own accord. So I get it.
Well, I appreciate you for appreciating what I was up against.
So you did mention about your experiences in an HBCU. And so I do want to quickly ask, I know HBCUs play a distinct and critical role in our nation. I even worked at Grambling State University for a while.
Mm-hmm.
What are some of the unique opportunities for those who are chosen to lead those institutions in these very critical times?
Wow. Let me tell you, I have had a lot of experience leading institutions, or at least as a fellow, as I mentioned, but and the plan was for Drew and UCLA to come together and develop a medical school in Watts for people who were going to serve in places like Watts. I got there, and I was the only one. I think there were two of us who knew how to treat sickle cell crises. And so they asked me if I would agree to have a phone by my bed at night. And when a patient came in, they would call me. And I did that. I'm not sure my wife appreciated it, but I did it. But you know what happened? I would get a call at 3 or 4 o'clock in the morning. I would get up and go to the emergency room and to treat the patient who was in crisis. I don't know if you've ever experienced somebody with a sickle cell crisis, but so it's quite an experience. So I was able to, as I had learned in both medical school and in my residency training, I had learned to treat sickle cell crisis. So I was comfortable doing that, but I also learned a lot of other things about Watts. When I would go into that emergency room, the sickle cell patients were just one of many different patients in the emergency room. There were other patients with a hypertensive crisis. There was a lot of violence, and I could tell you some stories about high school kids coming to the emergency room after a shooting or knifing or what have you. It was quite an experience, but also a very good thing happened, and that is that I believe President Nixon announced that they were going to set aside money for sickle cell disease. Some people probably remember that. And so the fact that I had been treating sickle cell patients and knew a lot about it put us in a very strong position as an institution. We had never received an NIH grant before that. It was the first time that the King Drew Medical Center would receive a grant from the National Institutes of Health. But we submitted our proposal. We had a lot of experiences to write about, a lot of expertise in treatment. And this is amazing. I was less than 30 years of age, and I ended up directing one of the 10 NIH grants for sickle cell disease. This is especially important now. I don't know if you're aware of it, but we have made a lot of progress with sickle cell disease. I mean, because of the research with DNA and changing DNA, we can virtually prevent sickle cell crises. So we've come a long ways, and I'm very pleased to have been a part of that, a small part of it, but being able to work with a lot of other people who committed a lot of themselves to research and service in this disease. So it was a long story. I'll try to keep it short and just say, it taught me something, and that is that sometimes when it seems like you're having an experience that's hard and unfair, sometimes it works out for the best. And getting up at night and going into the emergency room was not easy, but it turned out to be a turning point in my career, but also a turning point for the King Drew Medical Center, because that was our first NIH grant. It would be the first of many in terms of getting going. And a lot of young people had a chance to witness that and be a part of it.
Yeah, so thank you for that. And I have some experience with sickle cell too. When I was a registered nurse back in Louisiana and Florida, I used to do med-surg care. So I used to take care of those sickle cell patients that you guys would write the prescriptions for, and I would take care of them all night because I worked 7 p.m. to 7 a.m. So
that's amazing.
Turn of
I
experience.
commend you and I thank you. It's amazing.
No, thank you as well. So I do want to provide just a little bit of a forum to take some of the questions that some of the participants have shared. So I've got 2 questions I want to ask, and then I think there's some others too. But what do you recommend for instructors or faculty to better teach equity, especially its dimensions, health dimensions for our students?
Wow, that's a very important question. It's a tough one though.
Mm-hmm.
You know, how do you teach health equity? Dr. George Russ, who was here at the Morehouse School of Medicine for 25 years, I believe. When I came here after leaving the Office of Surgeon General, and I came here to develop the National Center for Primary Care, and Dr. Russ was my associate, and we worked together. And we published a study in the Journal of Health Affairs, and I believe it was in 2005, and it was about that very question. It was about what does it mean to eliminate disparities in health? Well, you know, if you know how things look now, how do things look once you've eliminated disparities? And we were able to show things like that if we had eliminated disparities in health in the last century, then in the year 2000 alone, there would have been 83,000 fewer Black deaths. And we were able to break that down in terms of heart disease, diabetes, and several things like that. It was interesting. And we did a similar thing looking at Black males during the crack cocaine crisis and what happened there, as many in the 80s. If you go back to 1980, then you see the curve of Black men dying going up. And let me just say this, I don't know if you're aware of this because I was not. If you go back to 1960, then Black women were more likely to die than Black men. It was not until about 1980 with the cocaine epidemic when many Black men were imprisoned, arrested, imprisoned and many families broke up during that period of time between 1980 and 1990. If you want to see those curves, it would be in that Journal of Health Affairs in 2005. I forget the exact issue, but you can find it just by putting in my name and the issue of excess deaths. So it was interesting. It was not until about 1990 that curve of Black men's deaths going up started to level off a little bit. But the beautiful thing is that for Black females, there is a downward slope in terms of deaths and excess deaths. In the meantime, Black females increase their high school graduation and college entrance. It's that part is really beautiful. The part that's unfortunate is what happened to Black men, and we haven't recovered from that yet. In terms of course, what happens to Black men happened to the whole family, and was a burden for the whole family. And we're still working on how do we recover from that. But I recommend that you just look at, because you just look at the curves and see how the death rate among Black women went down and continues to go down, by the way. And the death rate among Black men went up as more Black men were in prison and stuff like that.
So I have two questions. I'm going to try to combine them, but what types of incremental steps can we make in the public health sector, not even just public health, but just local governments, to begin to improve or, this lack of trustworthiness with public health right now? So these type of, it's like, you understand that question, or?
Yeah, I think
Okay.
I do.
Okay. I was trying to merge two together.
It's not the question that bothers me, it's the answer
Okay.
that I'm struggling for. No, seriously, it's a very important question. And let me sidetrack just for a minute and say that when I was director of the CDC, we decided that we could have an impact on diabetes in Native Americans because of the small numbers and the fact that some of them didn't. So it was easier to intervene in their daily lives, if you will. And we were able to get Congress to set aside some money to help us to do that. And as a result of that, and I showed this curve somewhere recently, but there's a curve showing how renal failure, which is a major consequence of diabetes, and it was a leading cause of death in American Indians. But the curves show how renal failure went down as we more aggressively treated diabetes in American Indians. Mm-hmm. And I say that, number one, because obviously the health of Native Americans is important, but also there's a lesson in that about what it's going to take for us to really make a dent on disparities in health. We're going to have to impact not just access to health care and the quality of that care, but we're going to have to impact lifestyles. We're going to have to impact the social determinants of health. All of these things are critical when it comes to how are we going to eliminate disparities, how are we going to achieve more equity, health equity when it comes to health and health care. All of these things are on the table, but they're doable. And that was the point that we hopefully made with that Native American study, that if you look at the curve today and compare it with what it was in 1996, then what's very clear is that renal failure among American Indians came down dramatically. And it means that by intervening, not just in the treatment, not just in the medication for diabetes, but also by intervening in lifestyle, which again is easier to do if you're dealing with Native Americans on a reservation. But now, if you were to say to me, how do we intervene in lifestyle among African Americans? Where do we start? And where, how can we be most successful? But believe me, in order to eliminate disparities in health, we are going to have to intervene in the social determinants of health. I served on the World Health Organization's Commission on Social Determinants of Health, and we traveled all over the world to look at how different societies dealt with these issues. So it requires more than medical care. That's what I'm trying to say. Mm-hmm. It requires an intervention into the social determinants of health, into lifestyle, We were just talking about our children and how dependent many of our children are on the quality of food they receive at school. And of course, when that's not available because of a pandemic or something else, then our children suffer even more. So we got to figure out how to bridge that gap between healthy lifestyles and what our children experience when they can't get nutritious food at school.
So we have just under 10 minutes left. So I think I have about 2 more questions that I really want to be able to get to. I want to talk about racism for a minute, because I know you mentioned it in your book, and you talk about you found that you could confront racism to help change things. And one of the challenges in some institutions is that the leaders themselves denounce racism, systemic racism in particular. And so I know Dr. Jones does a lot of work in this area, and I'm just wondering about your thoughts on how do public institutions work to dismantle racism?
Well, yeah, that's a major topic which Dr. Jones writes and talks about. She's really engaged in that issue. It's a difficult one, and she gives a lot of time and energy to that. And we're going to have to give even more to turn this around. Without question, racism pervades our entire societal structure. It's not just how poor women are treated on a ward when students are being taught how to do the pelvic exam and the disrespect involved in that. But you can go all the way out into the community and the homes and everything, and you can see examples of mistreatment and racism among people. I don't like to overuse the term racism, but it's hard to overuse it because it is so much a part of our day-to-day lives. And of course, we have lived that in the last couple of years or more, as we've experienced, maybe more so than we have before, the murder of Black men especially, and Black women by the police. And I say that because I think these are the people that we trust to protect us. And what we've learned in the last few years is how that picture is played out, how that game is played out in our society, and the lack of safety that exists. I never thought that I would see anybody putting their knee on the neck of any other human being and allowing that patient to take his last breath. That's what happened with George Floyd, but that's also what happened in other cases. These are terrible things, and obviously it wasn't the first time it happened. It's just the first time that the world witnessed it in terms of the way these men were treated. And of course, Breonna Taylor and the shooting that took place there in Kentucky. We have a lot of work to do, but at the same time as we're working on the police, we also got to work on our children. Got to let them know how critical they are and how much we depend upon them to take advantage of opportunities and education and all those things, so that this battle can continue to do away with racism. It's a long journey. It's not a short trip, it's a long journey.
So thank you for that. You mentioned law enforcement, you mentioned children, some of the work that we have to do. But in addition to those, what other top considerations should the Biden-Harris administration look to keep in mind as they begin to tackle some of these entrenched problems that we're experiencing?
Well, I think, excuse me, one of the things is that, and I think President-elect Biden is trying to send this message, is that as long as the police force and people in authority are overwhelmingly white, there is going to be a level of disrespect, a level of uncaring among the police, among the leadership in our country. And so first thing we have to do is make sure that we, those in authority, look like America. And I think that's the message he's trying to send. It's easier said than done, because you got a lot of history to deal with. But I think he's sincere in trying to do that. And he's bringing on some very talented and committed people. And that's encouraging.
So yeah, thank you so much for that. I want to once again thank you for agreeing to participate in this conversation. What I admire most is your resolve not only to drive changes, but to pour into others so that they can be motivated and inspired to lead in health equity. What I liked about your book is that throughout the book, you left these little morsels that folks could take with them as they begin to think about their own lives and their careers and how they shape and inform and promote the opportunities to promote health equity. So I wrote down educate, motivate, and mobilize. And like I've got that like it's etched in my brain and it's up above my desk because as a academic and a healthcare person and I guess I'm also public administration and all the other hats I wear, in addition to being a mother and a friend and a colleague, I want to thank you for all that you have done to create equity in health and health outcomes, because these are lives and livelihoods that we're talking about. So I enjoyed our brief time together. I wish you and your family very well during these very challenging times.
Thank you, Dr. Lopez-Littleton. Thank you, Dr. Satcher, for such an incredibly dynamic and fascinating discussion. And I'm still ruminating on what has been discussed. And just as an FYI, once we get the sign off from our panelists, we will share the recorded conversation with attendees. And you'll see in the chat that a link to Dr. Satcher's must-read book is there, so please check it out. And just as we close our time together, it seems fitting to share DSJ's statement against the double pandemics of systemic racism and COVID-19, which will be shared in a link in the chat right there. Thank you. And we built upon this statement for a JPay editorial, which you should also see in the chat. So once again, we at DSJ want to hear from you, your ideas, your concerns. More than anything, we want to collaborate with you and across the disciplines. We cannot do this necessary work of dismantling systemic racism and creating equitable and just systems and policies without you. So stay tuned. We'll be sharing more about our webinar conversation lineup in January. Thank you again to Dr. Satcher, to Dr. Lopez-Littleton, and to all of our attendees. Please stay well, please stay safe, and until next time.